educating you and creating awareness about health, and importantly, to understand the role that pharmacists play in ensuring that you have good health, that is you and I, in accessing medication. Like, what do you need to know? When you go to the pharmacist and you need some medication, what are some of the guidelines as a patient that you need to put in mind? And today I'm joined by Abul Manyon Mayen. She's a pharmacist by profession with over 8 years of experience, and she's here to share her wealth of knowledge to ensure that you, as a patient, as somebody who's seeking to get healthy and back on your feet, you get the right medication, but also through the right procedures and not through the back doors. We understand that there are a lot of gaps that are existing within our health system, but what can you do as an individual to ensure that you don't become a victim of the gaps that are existing? So, Abul, welcome to iRadio.
Thank you so much, Yar. My name is Abul Manyon Mayand. I am South Sudanese Australian, and I have been practicing in Australia as a pharmacist for over 8 years old. It is a great pleasure to be here today. Thank you for inviting me.
All right. Thank you also for being part of iRadio's part of the team that is providing information to the people of South Sudan. And Abul, maybe to just get a little bit of the role like pharmacists play in ensuring that patients get good access to medication. Maybe you can explain to us some of the various roles that pharmacists play in healthcare system in South Sudan, and maybe even where you've been practicing. As you said, you've been practicing in Australia, Melbourne, but also you've been here in South Sudan for some time now, and you have observed. And before we go to that, maybe you can tell us what are some of the major roles that pharmacists play.
Thank you so much. Yeah, pharmacy as disciplines actually play a vital role in healthcare in general. And to begin with, I think the role depends from one nation. It varies from one nation to a different country. Mm-hmm. And initially, from where I came from, pharmacists' roles varies from ensuring that patients have access to quality, effective, safe and affordable medications. The pharmacists also make sure or they sort of monitor the optimal use of drugs as well. Mm-hmm. Pharmacists are involved in research in terms of discovering medications and producing medication. Pharmacists are also involved in in different areas. Maybe that would actually just help inform the patient on how diverse the industry is. Mm-hmm. To begin with, we have hospital pharmacists, we have community pharmacists, we also have clinical pharmacists, we have industry pharmacy, we also have, compounding pharmacy as well. We have consultant pharmacists, which are expert in the field, in particular field that are consulted. We also have pharmacists that work in ambulance sort of services to make sure the patient that are being transported from home to hospital or vice versa get the right medications in that transition. We also have a pharmacist that work in-home services, they say in residential aged care. So it's a very diverse career, and it's also involved in antibiotic stewardship. In a simple term, just making sure the medication like antimicrobials are used in the right ways where we avoid resistance. Pharmacists are also involved in pharmacovigilance, which is monitoring of drug and making sure that the drugs that are being given to the patients are safe and they're doing what they should be doing. So it's a quite diverse field, and the role that pharmacists play in a healthcare depend from one nation to a different nations.
All right. Having mentioned actually the main role, that is actually ensuring the safety of medication for the patients to take in. And you mentioned the various practices of pharmacists, like we have the clinical, the hospital, and all these things. So which one is South Sudan actually doing at the moment?
From my personal observations, what is very common in the country, or where I have been, which is Juba mainly, is community pharmacy. Community pharmacy is quite dominant, and it involves establishment of a pharmacy which we can call a pharmacy, and also drugstores. And I will also come to that in terms of differentiating of what qualify as a chemist or a pharmacy and what qualify as a drugstores, and the services that are supposed to come from these different components. So yeah, I would say community pharmacies in general.
And maybe before we go far, you can tell us what's the difference between a drugstore and a pharmacist. If there is any difference, like you said, you'll come to it, but I think we can just address it at the moment.
Yeah, so a pharmacy and a drugstore, like I said as well, it depends with the country. From my understanding, from what I can see from South Sudan, there are 4 different licenses. So a drugstore is mainly, I think it's a license D in this country, which is usually given by Ministry of Health, and is given to a pharmacy assistant. So the pharmacy, the person that established the pharmacy is not a pharmacist, it's a pharmacist technician. And in the rules in South Sudan is it has to be a store that is less than 20 meters square, and that is run by a pharmacy technician, not a pharmacist. And there's a limitation of what services or what drugs can be stored and the services that can be delivered. As per the pharmacy, it is in South Sudan, I think it's a licensee, usually awarded by Ministry of Health as well, and it's awarded to a registered pharmacist, so it's not a pharmacy technician, and it is greater than 40 meters square area, and then it's where the pharmacist services are delivered, and the sort of medication that should be in the pharmacy differs from the pharmacy stores. So I have seen both pharmacy store and a pharmacy in the country, which are more like community-based pharmacy in general.
All right, and maybe before we get out of the issue of pharmacies and the drugs, what are some of the key issues that, let's say, before setting up a pharmacist, that need to be put into consideration for the safety of medication that are being stored in that particular store?
To establish a pharmacy industry, from where I came from, there are licensings that are required. So there's a process, or there is generally, let's say, there's the regulation that governs, or guideline or protocols that sort of governs what a pharmacy should look like in that particular country. In South Sudan, there was an act that was established. I think it's called Drug and Food Control Authority that was established in 2012. The main purpose of that was to sort of facilitate productions and distributions of drugs in the country. So the boards, there was a board and the secretariat body that sort of monitored what a pharmacy should look like, or the regulation of how pharmacy should be run in this country. And from a pharmacy or a safety perspective, there will be a storage of medication, which is something that is trusted to whoever establishing the pharmacy. But then there is also implementation of all the rules and policy that are required to ensure safety of the patient. But one of the things that I wanted to emphasize a lot is the storage of drugs in particular, because universally most medications that are kept within room temperatures are usually like above, just below 24 degrees. Above 25 degrees is considered to sort of interfere with the stability of the active ingredient from a drug. So one of the things that a pharmacy can do is to make sure that the storage condition of the medication, whether it need to be protected from light, whether it need to be kept at a particular temperatures, whether it need to be it need to be stored in a particular condition. That's some of the thing that some of the thing that a pharmacy sort of does at the background to ensure that when you open a pharmacy, the services that you deliver are safe for people that walk through your door.
All right, having talked about actually the temperature that is required to store and ensure that the active ingredient, which is actually the one that treats the patient, right, is still active. Having observed in South Sudan, we have a lot of drugstores and pharmacies to where there's no AC, there's no fan. So what impact does this have actually on the medication and the treatment process of the patient?
That's a really interesting question. First of all, when the manufacturer does the process of manufacturing, just to go back a bit, is there are conditions that are required. So when the drugs are manufactured and they are accurate medication, the right medication, they're not counterfeit, and they are delivered to you, and you kept them at temperature that you shouldn't be keeping them, what that does is destabilize the medication, and there's a very good chance that the medication you're giving might not be active anymore. It will still be there, but when you handed it out, when you hand it out to the patient, it might not be effective. But the role of the pharmacist, as I mentioned before, is to make sure that you provide safe, effective, and quality medication. So temperatures in South Sudan, generally the weather is a bit hostile and the temperatures are a bit higher than 24 degrees. So it's really a role of a pharmacist that is guarding the medication to ensure that storage is really important. Even when you get a really effective medication, if you don't store it well, it might destabilize the medication and it might just be giving a medication that is not going to help or not effective to the patient.
Talking about the drug not being effective to the patient, could this be now what we call drug resistant? Because we have had instances where people have continuously had the same sickness over and over and taking the same medication. So could this explain maybe when the active ingredient in the medication is completely destroyed and now the drug is there, but the ingredient that is needed to treat this particular patient is already destroyed by the heat or particular environment where the drug is being stored?
That there are two chances, or there are two sort of factors that can contribute to drug not being effective.
Okay.
The first is through the manufacturing process. Let's say if the drug is a counterfeit medication, and by definition, a counterfeit medications is a powder put together without active ingredient. So it is a drug, but it doesn't have the active ingredient in it, the right active ingredient in it to treat. So that is from a production perspective. The second way or second mean that someone can get ineffective medications is when the storage conditions are not right and the active ingredient is destabilized. What that means is what you are taking is not the drug that you think you're taking. It is just a powder medication that is not doing what it should be doing. So there's two ways to that. If someone, let's say, if you go and buy a medication that is counterfeit medication, and there's out there in the world, there are a lot of a pharmaceutical industry that probably might be producing active ingredient that are like medication that are without active ingredient. Or maybe if it is kept in the wrong conditions, so there's two ways you can get. But when it comes to drug resistance, generally medically is usually referred to when the microbial, which are usually the antiviral, the antibiotics, when they are used excessively. Let's say you use them excessively, like in a situation where the doctor do not prescribe medication, and you can just go to the shop and buy antibiotics, for example, and you use it excessively. What that does is your body become sort of resistant to it, and when you needed it the most, when you are now sick and you need it, the drugs, it's actually it is not effective as it should be. So there is a lot of, globally, it is an emerging public health issue, drug resistance, and is usually contributed to the microbial medication or the let's say the viral medication or the microbial medications.
So in that instance, because what we have observed locally is that a lot of people self-diagnose and self-treat themselves, right? You go to the counter and say, I want antibiotic or I want malaria drug. They already know the sickness, and so it's like, so in that instant, what should these patients or the people that go there do for their own safety? Because at some point it may be hard to control the drugstore or the pharmacist that give this particular medication.
That's an interesting question, and I have so many components to it. First of all, the healthcare system here is not readily accessible to citizens, and what that does is, if you cannot afford, for example, you can't afford consultation fee, which is roughly 10 to 15 SSB. If you cannot afford your option, you are left with an option of just going directly and buy from the. So you're doing two things here. You are self-diagnosing. You haven't seen I'm a registered medical doctor to recommend medication to you. And then you're going to the pharmacy and you're buying medication. And then if you're not given the education that you needed, you have actually skipped two professionals that should have actually delivered service to you. At the patient perspective, it is important, it's highly recommended from a healthcare perspective to actually seek medical advice, because in a medical field, the powers rely with a health professional. They know more than a patient does know. But then the patient has to be able to afford those services. So it's a very interesting relationship, but generally it is recommended that you might feel that you have malaria, but you don't have malaria. When you get tested, it might come out as something else. Or when the doctor collect your history, it might be something else different. So self-diagnosing is the risk of itself. It's probably not recommended, but what is recommended and what is practical is quite different.
And interesting enough, I just want to understand what danger or risk that it imposes on this individual person health, because maybe sometimes you self-diagnose and you feel like I'm actually having this sickness. And as you say, maybe they will go and diagnose you with something different, right? And so what does this have impact on individual health-wise, long-term impact? Because it may be not immediate, but a long-term continuous taking the wrong medication for the wrong sickness. And then the combination doesn't really make you feel better, or rather worsens your situation. So what long-term impact does it have on my health if I am doing that particular practice?
Okay, so generally from my perspective initially, if you're not well and you self-diagnose, the first thing you're doing there, you're delaying the help you need. And mostly when you can feel that you're not well, it means that you are sick and it's actually an emergency. You needed to see the doctor immediately. So by cutting the doctor out and you go straight and buy medication, one of the things you're doing is you're delaying the help you need. And you're getting the wrong medication that's not treating what you have. Let's say if what you're suffering is different from what you're buying medication, then what you're taking is not making any different from what you're suffering. So first of all, you're delaying the sickness and the help that you needed, the medical help that you needed. Second to that, you're putting in toxin into your system, because personally, I think medications are toxic. You're taking medication you shouldn't be taking, and you're incurring side effects from that medication that you shouldn't actually be having. And in long term, if you continue to do that, what that will do is you probably won't be getting the help you need. You won't be getting the medication you need. You won't be getting the medical advice that you need. And in long term, it might actually have a good impact, like a huge impact in your health, generally in your general health. Yeah.
Okay. Okay, in your observation, what are some of the most common health issues that you see in patients, and maybe how can a pharmacist address some of this?
Okay, so as a healthcare professional, pharmacists are not doctors, nurses are not pharmacists, and pharmacy technicians are not pharmacists. So there's really need of respecting our professional or our practice boundaries as to what we can do. From a pharmacist perspective, they are based on the guideline here in South Sudan. There should be guidelines that guide what health challenges we can help the patient with, and what health we can refer them to someone else that can actually help them better. So pharmacists are gatekeepers. So people come to us because we don't have consultation fee. They will come freely to pharmacists. So it's really a huge responsibility that a pharmacy can play in an environment like South Sudan, where you can sort of act as someone that can sort of now direct people to the right path that they should be going. So based on your professional assessment, if someone comes in, they're not feeling well and they're buying medication, first of all, you should be able to gather history of that person. It's like, for example, what do you need? Why do you need that one for? This is not to interrogate, it's to gather a helpful sort of data that you can now determine whether this person you can actually sell the medication to, or you can actually refer this person to a doctor to sort of have more further investigation. So my personal recommendation if you are a pharmacist, you need to gather history. have you taken that medication before? Do you take any other medication? If it is a woman of childbearing age, are you pregnant or breastfeeding? Do you have any allergies? Do you have any other medical condition that you have that can sort of not work? Because there's so much that can go wrong with medical condition. There's so much that can go wrong with medication. So that history will now determine if it is something that you're not sure from your capacity as a pharmacy. It's usually recommended that you refer those one to, instead of selling the medication, send them to the doctor. They'll come back to you and they will buy the right medication from you, because the doctor will determine that. So generally, as gatekeepers, I think it's a huge role that the pharmacists can play in this country to channel people to the right direction, instead of just maybe just providing medication that might be harmful to the patient.
Having practiced for the last 8 years in Australia and coming back to South Sudan, what are some of the differences that you have noticed, especially in the pharmaceutical industry and practice, that could be on the disadvantaged side of people locally here in South Sudan?
Okay, so the healthcare system in general, pharmacies not practice in a vacuum. Pharmacies usually practice in the healthcare system setting. So it really goes on to how the healthcare system has been set up in this country, and what policies, guidelines, and laws that govern pharmacy. So where I came from, pharmacy really play a huge role. It's set up, it's good to go. In a way that, in a sense that, it's heavily regulated, it is monitored, it is growing, it is expanding from, just giving medication and counseling to doing vaccination, doing huge research on medication that are existing, medication that's being established. So it's a really vibrant, rapidly growing industry. And some of the things that I've noticed in South Sudan particularly is the practice standard. The practice standard from where I came from is quite different. The regulatory that is governing this is different. The healthcare system in general, and how medications are sort of subsidized to make sure that people have access to it. The accessibility to all medications is different. We have access to a world standard sort of diverse medication. So it's usually a choice of government of what medication they can register in a country and what medication they cannot register. So there is a lot of gaps here in South Sudan. One of the major gaps that I have observed is the access to quality, reliable, effective medications is different. Second is practice, like I said, how we practice pharmacy here is heavily business. It is heavily business. Yes, there's a huge role that drugstores and pharmacy are playing by making sure that people have access to the medication, but there's also the ethical part of it on how we practice this medication or how we sell medication as well. That is quite different from where I came from. The curriculum, I believe, because I've had a look of the curriculum here in this country of pharmacy, how pharmacists are educated, how they are sort of do their practice and distribute it out to the world to go and deliver services is quite different. The channel is different. So it's a huge difference between the two. And I think from my personal perspective, there's a lot of opportunities as a new country to evolve as an industry. There's just need to be a lot of sort of training, accreditation, and sort of investment in terms of building the capacity of people that are practicing or going through the school in the country. Yeah.
Okay. So what are some of the effective ways to improve the health literacy among people? We understand that the literacy level in South Sudan is quite low, and this could be maybe one of the reasons why people are just consuming any drugs anytime, and just by you trust what the person, even sometimes I can borrow medication from a friend, assuming that we are having the same sickness.
Health in general, the healthcare professionals are trained for years to sort of have the kind of information that they have. It is usually not expected that the patient have the same information that healthcare have, but there need to be an effort in terms of community sort of education to educate patients in terms of what their rights are, what their what their limitations are in terms of what they can decide. So really, the approach to good healthcare practice in general is provision of information to patients, so they have access to information to understand like how to navigate the healthcare in general. So there's really need of let's say community campaigns to provide information in terms of how we consume healthcare in general, not just medication, and also just an emphasis on preventative health, because generally you don't need to be sick to seek healthcare. To be able to prevent it from happening at the first place is the essence of healthcare system. You need to have things like vaccination for medication that have vaccines to make sure you protect yourself from having, and that need education. That need a lot of education. You also need to check yourself generally, let's say after 6 months or 3 months, depend what the guidelines are here, to check yourself to make sure there's nothing happening, because we can help as healthcare professionals, we can help better when at the early stages. Let's say if you do general checkup and we can pick up something that hasn't shown the symptom yet, then that is a better choice than actually coming to us later on when you're sick and your body is weaker than it has to be. So there's really a huge need, and I think I would recommend that education in terms of just preventative health. We need to prevent health issues from happening. That should really be a bigger focus. And then when people are sick, sort of educating people on how to navigate healthcare. How do you consume healthcare? So a lot of education is needed. And I think campaigns or community education centers can sort of pass that down faster to the ground and help everyone have the information.
Okay, and maybe just to come back to, maybe you're talking about immunization, which is a very critical thing from childbirth, and also when there are some instances of cases where immunization needs to take place. So what role can pharmacists actually play in this?
That's a really, it's a very growing area. From where I came from, initially pharmacists were not allowed to do vaccination. It was a nurse and a doctor thing to sort of do the vaccination generally. But because there has been Australia moving very fast to preventative, and they really emphasize preventative health, and you need not only immunize children, you also need to immunize adults on particular emerging pharmacists can play a vital role. Pharmacists can be trained to do vaccination themselves. And because they are in contact with patient directly, and patient don't need fees to come to them, there's more chances that people actually come through to pharmacy more than they go to medical doctors. So if you can do that and you recommend vaccination, or pharmacists can be allowed to sort of train themselves, because you can't do it without training, to train themselves and be allowed to have licenses where they can run vaccination clinic within the pharmacy, something that the rest of the world has been able to do and do it very, very well. So that's an area as well where pharmacists can sort of help provide that preventative health in a bigger scales and take that burden off doctors, and so they can focus on other things that they can do better.
Okay, let's talk a little bit about maybe some of the drugs that should be given over the counter and some that should never be given, in your own observation, because there are so many drugs that could be given over the counter, and maybe like practically, like as a pharmacist, what are some of these drugs, especially looking at South Sudan situation?
Okay, so
and maybe just touch a little bit on actually for children and also for adults.
Okay, so drugs in general, the country decide how to schedule the drugs or how to break down the drugs. So in where I came from, there are unscheduled drugs, which is you can go to the pharmacy or actually just a supermarket and buy them. Those medications are usually considered to be of a lower risk to the population. So those one you can buy. But then there are medications that a pharmacist can assess a patient before giving it to them. Those medications, you cannot just buy it. You have to buy with a pharmacist actually approving for you to have that. And so they call pharmacist medication. But then there are prescription medication. These are medication that the doctor will have to write a valid prescriptions before the pharmacist can give. The pharmacist has no authorization to give someone those medication. But then there are, let's say, Schedule 8, which is with a lot of people call them opioid medication or drugs of addictions. In Australia, they call them Schedule D medications or controlled drugs. Those are drugs of addictions. You use them without monitoring, you get addicted to them, and you'll be looking for them to buy them. So those are dangerous drugs that are kept away. And then there's specialist medication where a specialist doctor specialized in that particular field can only prescribe those. It's not even just the normal GP. So it really varies from a country to country. In South Sudan, my observations is that a patient can buy any drugs here. Drugs of addiction, yes, they're in the hospital. So those ones probably not well accessible, but some of them are still accessible. So that's the risk we are running in this country by allowing people to sort of access medication without a doctor guidance, and also without actually just even pharmacist counseling, which is usually, it's really, it frightened me as a pharmacist.
Talking about what actually frightens you as a pharmacist, and also some of the things that concern us as citizens of this country. I remember, was it today, one of my colleagues was sharing like how he had gone to a pharmacy, and then one of the small boys, like really young, teenage age, came and was asking this. I don't know if you heard about codeine, this medicine for kids, yeah, but the youth use it for drug, yeah, as a drug. And there is also tramadol. Is it tramadol or stramadol?
Tramadol, yeah.
Yeah, so I don't know like what effect they have, because a lot of young people are abusing it, and they have access to it because of the loophole in the pharmacist, like with the practice with the individuals, because it varies from area to area, from individual to individual. Yeah, and as you put it earlier on, most of the pharmacists are probably set up for business.
One of the things that I would just comment something about children dosing. First of all, children are small human beings, so their body weight is lesser than what we have as an adult. So usually when you dose a child, it is dosed universally. It's dosed per weight of the body, and the reason they do that is you can have 5-year-old kids that have different weight. So if you want to get the right medication for that small body, then you dose it as per their weight, and you calculate the dose per weight. That's why it's very important, really, really important, because children are quite vulnerable to calculate, to tailor their medication based on their body. And that is, in where I came from, it is a role of a doctor and a pharmacist to work together to make sure that a dose that the doctor recommended is actually confirmed by a pharmacist that it's the right dose before it's given to children, and the counseling is provided to kids before. And the same thing with elderly population, because as you grow old, you become frail and your body is not as strong as it used to be, the weight reduced. You need to calculate the dose based on their body that they can actually tolerate it. And
so the dosage is given
dosage.
The weight, the weight.
Per weight for children, it's dosed per weight, and that includes antibiotic, paracetamol, all the painkillers. Kit dosing is dosed per weight, and that need to be calculated by a pharmacist or confirmed by a pharmacist and calculated by a doctor. Same with elderly population, their organs, where the drugs are filtered out. The kidneys are not that strong, their livers are not that strong, so you dose them as well, reduce dosage for them, and that depends per patient as well. When it comes to drugs of addiction, there's a lot of there's a lot of drugs that can be abused, and the reason for that is a lot of medications make you feel a particular way, and the reason they are called controlled drugs, like I mentioned before, is because of that addiction element to it. So you wanted to avoid accessibility, you limit accessibility, so people cannot do that. There are drugs like, pseudoephedrines that people can actually use to sort of make drugs, street drugs, we call them street drugs. Drugs like codeine in particular is usually, there's an age limit as to who can get that. and also there's a dosage, there's a maximum dose that could be that need to be decided by a country, what a maximum dose, and then normal medical supervision. Now, when people have access to this medication, what it does is it once you become addicted to it, once you use it once and you become addicted to it, you abuse it. You abuse it. But if you have access to it, what that does is you can get it. And if you can get it and you can abuse it, there's a good chance that you will take a dose that you shouldn't be taking, and it will harm your body in a long term if you continue to use it. So there's really a need for things like tramadol. From where I came from, it's actually Schedule 4, which is a prescribed medication, because it's not considered as that, but it still need to be monitored. And one of the way that pharmacists can monitor who is abusing one, which is a bigger gap as well in South Sudan, is we dispense medication. You put them in a software, and you know what medication you've given to what patient and what date. So if someone come back again tomorrow, and they come back again day after tomorrow, you can see from the computer that there's a history that you can have. So that's one of the way to control it. In a country like South Sudan, you could literally just move from one shop to another shop, and there's no dispense history. There's no dispense. We are not dispensing medication. We are writing 1 times 3, which is not adequate information even for someone that is prescribed medication. There's really a huge need for pharmacists in a country or the regulatory body to make sure the medication are dispensed in the software that people can see the history, because that history can be not only useful to the patient, it's useful to the pharmacist, it's also useful to doctors. When, let's say, a new patient come to you and there's a pharmacy that they go through, you can make a phone call and say, can you check for me what this patient has been getting? And the doctor can sort of identify if someone is abusing codeine, then they will not prescribe. So there's really a need for a dispensing software where we can keep history, and that could be a useful data to healthcare professional in restricting access to people that abuse medication.
Okay. Maybe some of the recommendations that you think can be improved on by the system and to ensure safe practice, both for the pharmacist and also for the safety of the patients.
I think from a patient perspective, patients just need to be quite vigilant. By the end of the day, their health is belong to them. So in a healthcare that is not quite well established yet, it is the role of the patient to sort of take care of themselves. In the meantime, while the healthcare is establishing or setting up, so there's really need to be quite vigilant. You need a professional advice before you can consume healthcare. That means going to the doctor is the right way, and go to the pharmacist and get the medication the right way. That's the recommendation generally. But I think from a health professional perspective, there are ethics that sort of withheld our practice in general and globally in general. One of the 4 factors that sort of, or principle that guide is beneficence. You want to make sure that you use your skills and knowledge for patient benefit, not harm. The other principle would be the non-maleficence. You do no harm to the patient. You try your best from the knowledge that you have to make sure that there's no harm that come through you to the patient. The other things as well as healthcare professionals is respect, because everyone that come through your door, whether you're a doctor or a pharmacy, is a father to someone, is a husband to someone, is a child to someone, and there is a need to respect that person in a way that the service you deliver to them are tailored in a way that this is an entity that is trusted to your care. And then lastly is accountability. I think as a healthcare professional, we need to, accountability is very important. And one of the way we can ensure accountability is to sort of take responsibility of our mistakes. That is, whether it's someone that you've given a medication to, or an error, because we are not angels, we do mistakes everywhere. One of the gaps that I have sort of identified in a country is record a medical history. Let's say if you give medication and you give a wrong medication, or you give, let's say someone comes in as a pregnant woman and you give them ibuprofen when you should be giving them paracetamol, and there is a miscarriage that happened, you need to account to that. It's your responsibility to account as a licensed healthcare professional. So really just ethical practice in a country where we are, ensure patient safety. And I think it's regulated by the system, the healthcare system in general, the Ministry of Health. So just governance and ethical practice would ensure that the services delivered to the patients are safe. Because as a pharmacist that I've practiced for years, I know the medications are toxins. And I know something as simple as giving ibuprofen to a pregnant woman can cause miscarriages. Something as simple as giving the ibuprofen to asthmatic patient can cause an asthma episode. Something as simple as dosing a child without calculating the weight of that child and making sure it's dosed the right way can cause problem to that child. So really it's just practicing right, and that can only be improved through education and training and ethical practice.
Okay, your last message to the people of South Sudan, the people that will watch this interview, and also the people that, look at the situation in this country and they seem confused, and especially talk to them about their health and how important it is, because every medication they consume has an impact on their health.
Yeah, thank you. Yeah, thank you for having me. My last message is really to customers is to be cautious on how we consume medications. Something as simple as Panadol can cause liver failure if it's taken in huge amount. So really just taking caution every time you pick up a drug or pick up a medication is a potential harm that you can cause to your body. Some that you can see immediately, some that you cannot see, and in a long time can sort of catch up with you. So how we consume medication in this country, we really need to be careful. We need to be careful what we consume. We also need to be not sharing medications. I would recommend that we don't share medication. I would also recommend strongly that we don't self-diagnose, that we actually seek professional help by going to the doctor and then going to the pharmacist to get the right medications. I would recommend that our health is individual responsibility. And we need to empower patients to be responsible for their health, because healthcare is not when you come to us when you are sick. Healthcare is where you sleep, it's where you eat, it's where you consume, even what you read and what you expose yourself to. That's healthcare in general. So holistic health, don't only look to your health when you're sick. Holistic health is where you eat your diet. Holistic health is how you ensure, if it is too sunny, you make sure you protect your eyes, or it's eye protection. It is little things that you do at individual level that by the end of the day is make sure that you're a healthy person. So really just looking for information and empowering yourself to make sure that you are you are kind of person that consume health cautiously. That's great. To healthcare professional, initially, generally, healthcare are looked at people that put their patient first before money, are people that sort of prioritize the care or the well-being of their patient before profit. Generally, we are known for that. In this particular country, we really need to take that to the next level. It is important, or I really like to appreciate people that ensure, let's say, drugstores and pharmacies that make sure that our patients have access to drug. But the next level to that is to ensure that we practice safely, that we make sure the patient get the right medication, we make sure we direct people to the right side. The profit do not outweigh our care or as our professionalism or our healthcare responsibilities. I really hope that the interview I've done today sort of informs someone to do the right thing by themselves.
Thank you so much, Abul Manyuan, for your insight. It's actually, I think that this is for somebody who is going to watch this interview, should be a changing point in your life. If you've been consuming drugs anyhow, I think this is something that you need to look into. And I think my guest, Abul, has said so much that I leave it to you. Your health is your priority. And so you need to look into that. And we continue with more segments about health next time on iRadio. Don't forget to share this video, comment also, and let us know what are your thoughts on this issue of drugs, especially around South Sudan, and how people consume over-the-counter drugs, and what responsibility or role you play as an individual. I'm your host, Tiara Jackling. Do have a great time, and let's meet next time. Don't forget to share on Facebook, on YouTube, TikTok, every other platform that you'll have access to this information.